Hi, I want to talk to you about recent developments in the evolution of the coronavirus pandemic that is now impacting children in a way that we have not seen before. Over the past few weeks, there have been occurrences of a rare but sometimes fatal illness in children that seem to be related or linked to COVID in some way. This is being called pediatric multi-system inflammatory disorder. This first emerged in the UK and other European countries, but is now being seen or suspected in at least 18 states, including New York and New Jersey. The syndrome is being linked to coronavirus for two important reasons. First, it is being seen in clusters of COVID-19. And second, many of the children, but not all of them, have tested positive for the coronavirus, whether that is the antigen test or the antibody test, which indicate that at some point in the past they were exposed to the virus. This illness does have some resemblance to another rare condition that is also seen in children, referred to as Kawasaki syndrome, but there are some significant differences. The biological basis of this COVID-related illness in children is not yet understood, but it's thought that this is a post-infection related condition whereby the inflammatory system mounts a delayed and perhaps aberrant response to the virus that eventually lead to multiple organ failure. This illness is associated with a variety of symptoms, including high fever, rash, abdominal pain, malaise, sometimes nausea and vomiting. Unfortunately, in some cases, this can lead to admission to the ICU, and a number of children in the US and overseas have died as a result of contracting this disorder. This is a treatable condition, so I urge parents and guardians that if you see any of these symptoms in children, you should contact their pediatrician immediately to have a discussion about what is taking place. If that is not possible, by all means, reach out to emergency services. This coronavirus-related illness in children, thankfully, is rare, and we want to take steps to make sure that it remains a relatively rare occurrence across the world. So my advice are severalfold. First, we must continue to encourage our children to practice all the measures that have been put in place to limit the spread and the potential for exposure to the virus. Second, children need to continue to practice good hand hygiene, and they need to continue with social distancing. We can see that as the weather is changing, our children are starting to move outdoors and starting to congregate, and we should make every effort to discourage that. In the meantime, stay safe, take care of yourself, and take care of each other. Goodbye.